Assalamu alaikum friends, welcome to my YouTube channel. My name is Dr. Muhammad Awais. Today my topic is the Pharmacist Licensure Examination, that is SPLE and SPLE guide, and today we will discuss if any pharmacist want to settle in Saudi Arabia, he or she must have to clear the SPLE exam if he or she want to work as a registered pharmacist in Saudi Arabia. So watch my video till the end. First of all, please subscribe my channel Dr. Muhammad Awais so that you can get all the new videos, and click the bell icon so that you can get notification of all my videos which I specially made for pharmacists and other healthcare professionals. And stay tuned up to end of my video. So the pharmacist licensure examination eligibility to apply for SPLC, you must have Pharm.D and B.Pharm degrees. 2 years practical experience is required for SPLE, and 2 years experience you must have experience of retail pharmacy or a hospital setup, and this experience is also required if you want to apply as a registered pharmacist in Saudi Arabia. And now SPLE composed of 300 multiple choice questions. The test consists of 6 hours. Examination consists of 4 major pharmacy areas. Number 1 is 10% basic biomedical sciences. Number 2 is 35% pharmaceutical sciences. Number 3 is 20% social behavioral administrative sciences, and 35% of clinical sciences. This is the composition of the test and the areas which are included, and 10%, 35%, 20%, and 35%. And these are the areas from which the test come, and you must read all these areas carefully in order to clear the test. Number 1 is basic biomedical sciences, 10%. It includes number A, physiology, functions of the major body systems and homeostatic impact at organ and system level. And number B is biochemistry, chemistry and utilization of biomacromolecules, including proteins, lipids, carbohydrates, nucleic acid, enzymology and coenzyme and kinetics, cell chemistry, signal transduction pathways, DNA and RNA science, and protein synthesis. Number C is microbiology, related to the human diseases, structure, function, and characteristics of microorganisms, pathogenic microorganisms of humans, that is causative agents and transmission. Number D is immunology, innate and adaptive immunity, principles of antibody actions, hypersensitivity and types of reactions, and molecular genetics. And this is the immunology and microbiology related to human diseases. These are all the topics, and you must have to study, focus these points. Now, area 2, pharmaceutical sciences. It includes medicinal chemistry. Number 1, physiochemical properties of drugs in relation to drug absorption, distribution, metabolism, and excretion, ADME. Number 2, chemical basis for drug action. Number 3 is fundamental pharmacophores for drugs used to treat diseases. Number 4, chemical pathways of drug metabolism. Number 5 is applicability of structure, activity, relationship to make the drug therapy decision and drug development process. This is the area 2 with pharmaceutical sciences, and this you must have to study these areas carefully. And number B is pharmacology and toxicology, mechanism of action of drug, various categories including biologics. And number 2, pharmacodynamics and response. Number 3, classes of drugs including individual agents and their approved indications, adverse effects, side effects, contraindications, and teratogenicity of the drugs. Number 5, mechanisms of drug interactions, drug discovery and development, acute and chronic toxicity including drug and chemical overdose, antibodies, antidotes. You must study these. Number C is pharmacognosy and dietary supplements, concepts of crude drugs, classes of pharmacologically active natural products, science of dietary supplements, vitamins, minerals, and herbals. This is the pharmacognosy and dietary supplements. You must know the crude drug concept, and you must know the dietary supplements, vitamins, minerals, herbs. Must have these concepts. Then is pharmaceuticals and biopharmaceutics. Biopharmaceutical principles of the drug delivery to the body via dosage form, that is liquid, solid, semi-solids, controlled release patches, materials and methods used in preparation of drug, dosage forms, physiochemical properties related to the dosage forms, principles of drug and dosage forms stability, including chemical degradation and physical stability. Number five, principles of biotechnology and its application, and principles of drug dosage form administration. And this is the point of biopharmaceutics and pharmaceutics, and you must study all these concepts carefully. Now becomes pharmacokinetics, that is basic principles of in vivo drug kinetics, principles of bioavailability and bioequivalence, and physiological determinants of drug onset and duration, including disease and dietary influences on absorption, distribution, metabolism, and excretion. This is the pharmacokinetics, and you must know, you must have complete knowledge about the pharmacokinetics of the drugs, that is absorption, distribution, metabolism, and excretion. You must have grip. Now there becomes F, that is a sterile and the non-sterile compounding. International Pharmacopeia guidelines on sterile and non-sterile compounding, techniques and principles used to prepare, dispense extemporaneous preparations, and chromatography and chemotherapy agents, including labeling, dating of the compounding dosage forms, pharmaceutical calculations, sterile admixture techniques, including stability, clean room requirements, and sterile testing and dating. This is the sterile and the non-sterile compounding, and you must know complete knowledge about the sterile and non-sterile compounding. Now there becomes number three, that is the social behavioral administrative sciences. 20% of the tests come from this part. It includes healthcare delivery systems and public health, organization of the healthcare delivery systems in the Kingdom of Saudi Arabia, social and political economic factors that influence the delivery of healthcare in the Kingdom of Saudi Arabia, public and health awareness, chronic diseases prevention, health promotion, infectious disease control, demographics, physical, social, and environmental factors leading to disease, comparing and contrasting public health with individual medical care. So this includes 20% of the test. Now B, that is a population-based care and pharmacoepidemiology, data sources and analytical tools that provide an estimate of the probability of the beneficial or adverse effects of the medications used in large populations. Applications of the epidemiology study designs to evaluate drug use and outcomes in large population. Methods for continually monitoring unwanted effects and other safety related aspects of medication used in large populations, and pharmacovigilance and medication safety. So this is population based and pharmacoepidemiology, and you must have complete knowledge about this point. Now there becomes pharmacoeconomics and humanistic outcomes of healthcare delivery. Pharmacoeconomics analysis and its applications to improve the allocation of the limited healthcare resources. Humanistic outcomes and their applications to improve the allocation of limited healthcare resources. And these are the resources and healthcare resources, and you must have complete knowledge. You must have studied these points in depth so that you can get complete knowledge about these points. Now there becomes pharmacy practice management principles, planning, organizing, directing, and controlling pharmacy resources applied to various pharmacy practice settings and patient outcomes, marketing of products and services, that is product versus service pricing, distribution, promotion, accounting, budgeting, and financial management. These are the points which is included in pharmacy practice management, drug distribution, drugs promotion, and drugs marketing. And you must have proper knowledge about the drug marketing, drug distribution, and accounting, budgeting, and financial management. These are the very necessary points you must keep in your mind. E-pharmacy law, regulatory affairs, legal and regulatory principles apply to the pharmacy practice, dispensing professional services, drug use control, administrative, civil, and criminal liability, authority responsibilities, and operation of agencies and entities that will promulgate or administer laws, regulations, guidance, and related to the practice and prescription controlled drugs and non-prescription medications. These are the points which you have must keep in mind according to the pharmacy law and regulatory affairs. You must have a grip on these points. And then is biostatics and research design, research study designs used in medical research, application and interpretation of statistical tests and data collection instruments. And this is the point which you must have a proper knowledge about biostatics and research design. And a lot of questions come from this part, and you must keep all the information about these points in order to clear your SPLE exam. And this exam is very easy if you study all the aspects of this topic. Then G is ethical decision making, principles of biomedical ethics, and then is the research ethics. So ethics point of view, from ethical point of view, you must know about the ethics and ethical decision making and their principles, and in order to clear the SPLE exam, good marks. Now there becomes H point, professional communication, principles of communication abilities with patients and caregivers, including empathetic communication and effective use of healthy literacy tool, principles of communication abilities with other healthcare providers, measurement and use of healthy literacy in pharmacy communication. So this is the professional communication which is very necessary for pharmacists and to study these professional communications. And these communications are plays very important role in order to develop a relationship with other healthcare professionals. And so this point must be studied in a deep way. There become social and behavioral aspects of pharmacy practice, application of behavioral modification principles in health and illness behaviors of patients, patient adherence to therapies and recommendations. And this is the social and behavioral aspects of pharmacy practice, and it is also included in these points. Patient adherence to therapies and recommendations. Patients must adhere to the therapies and recommendations and follow the guidelines which have been given by the physician to the patients. Application of behavioral modification principles and behavior in this point of view. So social behavior aspects should be studied a lot. Then is medication dispensing and distribution systems, systems for the safe and effective preparation and dispensing of the medications. And then is in all types of practice settings, role of automation and technology, pharmacy informatics and the information management, establishment of error reduction program, identification and the prevention of medication errors. So these are the points which must be kept in order to medication dispensing and distribution systems. And these points should be followed if you want to reduce the error which are being done by the patients or the pharmacists. So reduce these errors. Then becomes clinical services. Approximately 35% of the tests come from this part. Number A is drug information and evidence-based practice. Interpret and evaluate drug information and evidence-based practice in the patient care. Apply drug information skills for the delivery of the medication therapy management. Interpret guidelines as they apply in clinical settings. So clinical services are also very important part of the SPLE exams, and 35% of the tests come from this part. So you must keep proper knowledge about the clinical services in order to clear the test. Then becomes clinical pharmacokinetics, identify common drug that require therapeutic drug monitoring and utilize appropriate monitoring. Pharmacokinetic parameters to avoid toxicity and maintain efficacy. Clinical pharmacokinetics is also very important part for the pharmacist to study. And if you want to avoid the toxicity and maintain the efficacy of the dose, so this portion should also be studied very clearly in order to clear the SPLE exam, and which is for the exam for the pharmacist, which must be cleared by the pharmacist in order to practice as a registered pharmacist in Saudi Arabia. So these points from clinical should also be considered. Now there becomes clinical pharmacogenomics. Utilize basic pharmacogenomics information to in-vivo drug therapy, disease prevention, and population health. Recognize the proper use of non-pharmacological therapies, including complementary and alternative medicines. Describe measures to promote wellness and disease prevention. And so these points, clinical pharmacogenomics should also be studied, and pharmacists must have the information about the disease prevention and population health. and describe measures to promote wellness and disease prevention. So proper disease knowledge, its etiology and its prevention should also be studied by the pharmacist, and this is the should be kept in the knowledge of pharmacy in order to clear the SPLE exam. So number is patient assessment describes the techniques for obtaining comprehensive patient history, identify and prioritize drug-related problems, interpret common clinical laboratory values and diagnostic tests. So patient assessment is also very important part of the SPLE exam, and you must know all the techniques of comprehensive techniques of the patient history, identify the patient-related problems, and the diagnostic tests and laboratory values. You must have a grip over that knowledge in order to get a accurate patient assessment. Now there becomes F, that is a clinical pharmacology and therapeutic decision making. Apply concepts of pathophysiology to clinical decision making. Assess pharmacotherapy considering contraindications, therapeutic duplications, adverse drug reactions, and allergies. Monitor drug therapy for safety, effectiveness, non-adherence, misuse, or abuse. So, from clinical point, pharmacists should know about the pathophysiology of the diseases and proper parameters and contraindications of the drugs and the allergies of the drugs to the patients, which are also been assessed. So monitor drug safety, effectiveness, and abuse. Now, thanks for watching my video. Please like, share, and comment on my video. I have specially made this video for the pharmacists who are forcing me to make a complete video about the SPLE exam.